Yeah, my name is Breda Eubank. My pronouns are she and her, and I'm an assistant professor in the Health and Physical Education department. So the bulk of my research involves improving quality of health as it relates to bone and joint health, particularly for the community and at the health system level. So I have a role in the Musculoskeletal Transformation Program, which is a strategic initiative of the Bone and Joint Health Strategic Clinical Network of Alberta Health Services. So the overarching goal of the Musculoskeletal Transformation Program is to bring together a bunch of stakeholder groups like patients, physicians, allied healthcare practitioners, researchers, policymakers, and administrators, and coming together to figure out how to improve the quality of care for the community. So musculoskeletal health or bone and joint health doesn't really get as much notoriety because it's not life-threatening and it's not catastrophic. But the thing about bone and joint health and musculoskeletal conditions is that everybody gets it. And with our aging population, the older that you get, the more injuries and the more problems you tend to have. And if these problems are left untreated, you end up decreasing your overall quality of life. You end up in extreme pain and perhaps severe disability. And so if we can tackle the problem early and we can help the community wayfind through the system, because quite often it's quite complicated, we can help the community better find their way, the right place, the right provider within the right time frames with the right outcomes. I know you've heard that saying multiple times before, but that essentially is what we're aiming to do. In order to effectively change the system and have a meaningful change within the healthcare system, you actively need to engage the community. If you're designing research studies or you are resulting in particular outcomes and objectives and they don't meet the needs and the desires and the wants of the community, your outcomes are going to be meaningless. And so in order to have an effective quality improvement plan, you need to really engage the community at the patient level. You need to find out their perspective and hear their stories, and the same for the clinicians and the healthcare providers. We know that they've been struggling, especially since the pandemic and post-pandemic overload of the healthcare system, and they really have their own stories and how to mitigate challenges and help to improve the system themselves. Yeah, and in health and physical education, our main goal for all 4 of our majors is that our students, at the very minimum, become promoters of health and wellness. And in order to do that effectively, a lot of our students go on to graduate school. They go on to professional programs, especially like health provider programming, and they go on to health and wellness jobs. And for them to be able to receive firsthand knowledge of the research that's going on in the province with respect to health and wellness, and for them to be able to take that knowledge and apply it to their future goals and aspirations just serves them better and sets them up for success as they graduate from Mount Royal. I think with community engaged research, you just have to be patient. Like I said, change is really slow, and it takes a lot more work to engage all the multifaceted stakeholder programs and organizations that you need to make your research program a success. And you just have to be patient. Sometimes the change takes decades, and you just have to keep engaging the right people, which will allow you to produce successful outcomes, which will allow your research program to be more successful overall.